to every one of you watching us on Joy Prime Television and also on Joy99.7 FM. This is Home Affairs. My name is Endometriosis. How are you doing this morning? As you can see, I am glowing and I am fine. I do hope that you are doing very well too. This morning, I came across this and I thought I should share it with you. Don't forget that you're human. You are only human. So it's okay to have a meltdown every once in a while. What's not okay though is you unpacking and deciding to live there. It's okay that every once in a while you have a meltdown. What's not okay is deciding that that place becomes the place where you will settle. Cry it out and then refocus on where you are headed. It's very important. When you get to that point, yes, relax. Take all the time you need to cry it out, to go through the emotions and all. But remember that you can't stay there. When you stay there, that's where you become a loser. So cry. They say it in Chi some way. Usuka cry knowing him, then you wipe your face and then you get up and you get going. If you need help to get up, seek for help and get up. But by all means, don't stay there. That's what not okay. One more time, you are welcome. Our show is Home Affairs and it's sponsored by Amasha Partners Limited and Eye Care. Curl Charcoal Toothpaste for white teeth and fresh breath all day long. This is another quality product from Samara Company Limited. Curl Charcoal Toothpaste, Happy Smile, and Music Haven, your musical coach. In a bit, I will tell you, give you more details about what our sponsors are up to and how you can get in touch with them. Our show begins now. Last week we started a conversation and we simply are saying it's time with the obstetrician gynecologist, and we are hanging out again with Dr. Padi Aryertey of Elimas Health, right?
Yes, indeed.
He's the organ at the top at Elimas Health, and it's always exciting to have Dr. Aryertey. By the time you're done listening to him, even for 20-30 minutes, you'll feel like, you're on top of issues, and that's if you're paying attention. And most importantly, you will take steps to be able to get your health on track. If you realize that by the questions, we may not be able to answer your question, but someone's question could be similar to yours. So you pick up the answers and you want to work on it. So today too, we have questions from last week. We'll start with them and then continue to take your questions on 055 1111 997, 055 1111 997, and hopefully we are able to activate the phone line sometime within the show on 0302 216541. But right now you can send your questions through number again 055 1111 997. We're live on Facebook, we're live on YouTube, we've got our tweets going on, and the handle is Joy997. I will also remind you of the rest of the programs we have coming up within the day so that you will be able to stay tuned and, live here on Joy. Doc, good morning. You're welcome.
Good morning. Thank you very much.
Good to have you again.
It's my pleasure to be here.
Great. Sometimes I wish that some of the conversations we have off air, we can have them on air. But that's okay. So we go on to our first questions. You ready? Can we go?
Good to go.
Great. So our first question says, good morning. Please ask Doc, can candidiasis come back again after treatment in 2 weeks?
Yes, it can.
That answer me crying new.
Yes, it can. It could either be that the treatment that was given was inadequate, so the infection has maybe gone down a little bit and then grown up again. It could also be a new infection. So if the place you went and got the first one,
the place has not been treated,
you went back there again,
and the place has a problem.
You can go and get a new one. So it's not. It is possible.
Yeah, and how about if you abandon treatment? You don't finish the treatment.
Problem with abandoning treatment is, so we give you the medication takes for 7 weeks or 7 days. Sorry, and they take it to 3 and you stop. So what happens is that the infection goes down, and then you stop taking it. Some will die. But the other ones who didn't die now come and say, oh, we know you now. We know this medicine. Those ones that are able to survive that medicine are the ones that will grow again
and become more stubborn.
Because when you use the same medicine again, they're like, oh no, this medicine doesn't work.
They're used to it.
That is when they'll tell you, Paul, I know. The other ones I know, but you says I know, but I don't know you.
So yes, he's giving you the 3 instances that, and the last one, I mean, it seems like a very strong one. That is, if you abandon treatment, and those who don't die, they will come back sometimes
With
even
force.
stronger. And then Doc also talked about the fact that maybe you go back to go and contract it within that same period, so it can recur. And the third one, if the treatment wasn't adequate.
Great, yeah.
Okay, so yes, 2 weeks treating candidiasis and it's coming back, very, very, very likely. And Doc.
Yes.
Okay, so this thing about candidiasis, does it also come with a smell?
Typically, candidiasis shouldn't come with a smell.
Okay.
But it can combine with another infection. There's another infection that walks right beside it. And that infection comes with a smell.
The smell.
So once you come, and it's a specific, unique smell. Oh, Lord.
Oh, Doc, it's okay. I need to.
So once you have that kind of a smell down there, please, the treatment is simple. Actually, there are just 2 tablets. You can take it. It would go away. Before, we thought it was purely a bacterial infection, and it was not transmitted. It was not transmissible. Now we believe it is transmissible. So
the other one.
Yes, the other one. So it is possible to get.
What is it called?
Which one?
The other one you're talking about. That comes in.
Does it make a difference? Your doctor is supposed to figure it out for you. We don't want you going to the pharmacy and say, I want this one. Doctor says this is what.
Oh, no, I wasn't actually asking about the tree. I wanted the name of the condition.
Yeah. Okay, so the condition that comes with the smell is called a bacterial vaginosis.
Ah, okay.
And it's we believe it's caused by some particular organisms, but the important thing that is characteristic about it is that it's got a unique kind of smell. So if a client comes and tells you I have a smell, you say describe it. The moment she uses one word, you kind of know in what direction you are going.
Me cry, I know that one too. Now, still on candidiasis, right? Now, if you have a woman has vaginal discharge, this whitish, discharge, and it's not probably itchy, it doesn't smell, but it's regular. Is it cause for concern?
It may not be.
Okay.
Because the vagina has some fluid inside. It is not a dry place. What is concerning is if that fluid is enough to be flowing out.
Oh.
See, the fluid is flowing out, then we are concerned that something is not right. But if you put a speculum inside and open and you look into every vagina, you would see a small amount of fluid there, and you see a small amount of whitish fluid. Let's put it that way.
Okay.
A small amount.
So I asked all your questions for you. You know yourself. Good morning, Adam. My wife had BTL after our 3rd child. After that, it took a year, 8 months before she started having her menstruation. Thereafter, every menstrual period is accompanied with very severe headaches, which has persisted till date. This is from 8 months. It has been 3 years since she had the BTL, and this is Kojo very worried about his wife.
I'm not sure it came from the BTL.
That's giving her the
headaches. I think it's something that she needs to be assessed for. Some people have this problem without having a BTL, so it's not necessarily a BTL that caused it. So it's important that she sees a doctor for him to assess it properly and try and find out why she's having the headaches that she's having around the time of her menses.
So for the sake of people who don't know BTL,
bilateral tubal ligation. It's a process where when you, at delivery or after delivery, we tie your tubes. The tying your tubes is a very simple process. It's like you take a piece of thread, you make a loop, you tie around it, and you cut the loop that is on top of it, so that the objective is the sperm does not meet the egg. That's all it does.
So it's a birth control.
It's a birth control method. It's a permanent birth control method, essentially irreversible. So you shouldn't regard that, I'll go and turn it back again. It's not impossible to reverse. It's just the results are not very good. And so we don't encourage. If you're going to do it, be sure that it is the last thing you want to. You've had your last child and you are done.
I don't want to start that advocacy, but if you ask me, right, a woman will carry pregnancy with all the issues that come with it, 1, 2, 3, sometimes 4. And then when she's done, she has to go and do this. You people should go and do vasectomy.
Oh, not a vasectomy is. I think we need more people having the skill to do vasectomy.
Is it the skill or the men?
No, first of all, if you want a vasectomy, you have to ask around before you find a place for somebody who does it. We don't have as many options available.
How many men have you heard asking around for
vasectomy? I know people who have had vasectomies. I've known people who have had vasectomies.
No, I mean the shopping around, asking around. Like women would want to do other forms.
Oh, a lot of men have called. I want a vasectomy. Where do I go? And so see this person, he'll do it for you.
Hey, dog camper.
Yeah. Sometimes it's the women who are telling them, "Master, don't go and do it."
Maybe it's the ones that I talk to. Oh, Mr. Ajima, good morning. You mention your name. So it's the day he tries that thing. That will be the day the witches in his village will chew his children. Good morning, Adam. I have 2 fibroids. I have had. Is it that I have 2 fibroid operations? Okay, so she has had 2 fibroid operations already. It has come back again, with the largest being 4 cm in size. I don't want to go through the pains again. So what should I do? 47, and she has no children.
I'm assuming that by the pains, she's talking about the pains of surgery.
Okay. Yeah, well, because she hasn't said that the fibroids. Yeah, I think this one, the doctor.
We shall assume.
Maybe you should handle both
assume
pains.
It's the pain of the surgery. At 40, okay, the research in this country has shown that the average age of menopause is 48.
Okay.
Amongst Ghanaian women. But some people go further into their 50s. Generally, once you hit menopause, the fibroids shrink in size and are no longer a challenge. So if the fibroids are not causing a problem and she's willing to wait it out, then she can leave it alone. She'll hit menopause soon. Fibroids decrease in size and don't cause any more issues, and that'll be the end. She wouldn't need any significant interventions. On the other hand, if the fibroids are causing trouble, then we may have to consider doing something about it. In doing something about it, there are options. Option 1, there are medications that you can be given that would stop the growth of the fibroid, shrink the fibroid until you hit menopause, and then you don't need to take the medication anymore. Option 2, you can have what we normally call open surgery, which I don't think is the one that she wants to have because of the amount of pain that comes from it. Option 3, depending on the fibroid's location, you can have a keyhole surgery.
No matter the size?
4 centimeters is possible.
Okay.
For her size, it's possible. But it depends on the location, how deep it is inside the muscle. But you can do a keyhole surgery where we make small holes. The largest hole will be about, in her case, 10 millimeters. That's 1 centimeter.
Okay.
4 or 5 holes on her tummy, and go inside, remove the fibroid through those small holes, chop it up into small pieces, and get out of the tummy. The pain you have is like a day's pain.
You chop it out where? Inside the...
Yes, there's a machine you use to chew it up, put it inside the bag, and then chew it up. So that the fibroid is 4 centimeters, and you are bringing it out of a 1 centimeter hole. So there are ways you can cut it up and bring it out in small pieces. Yes, so that surgery is available in this country. So if she wants to remove it, it can be done.
Let me ask what's on my mind around this. Doc, don't laugh. So what is inside the fibroid?
A combination, a little bit of muscle tissue, but a lot of...
Does it have fluids in it?
No.
It doesn't have fluids?
No, it's hard.
It's hard. Okay.
A lot of fibrous tissue. That's
it's
why we call it
if
the
it doesn't
fibroids.
have fluids, then my question is invalid.
If the fibroid undergoes degeneration, in other words, rotting, the middle can rot, for lack of a better word, and that's because when something rots, fluid comes inside. You may have some small fluid in the middle of it. But it's usually hard, like a tennis ball.
Because I was going to ask, of course, I am not a doctor, I try, right? I was going to ask that, okay, if you're chopping it inside and it has fluids in it, isn't it possible that these fluids can leak into your body and have issues?
Okay, good question. Actually, it's a very good question. There's a bag. So when you are getting to that stage, you would introduce a bag into the tummy, pick the fibroid and put it into the bag, and then chop it up in the bag.
Oh.
So anything that comes out
will be in the
bag. It's also to prevent spread of any, in case there's something in a fibroid that will cause trouble, it prevents spread.
Lord have mercy.
So we thought of that one. We thought of you when we created that one.
So it was a very valid question.
It was.
Now, I want to ask still 2 questions related to fibroid. Now, once you bring the questions up, I do my follow-up questions. You talked about the fact that if the fibroids are not causing troubles, what troubles do fibroids cause? Or what are some of the troubles?
Mass effect. It makes your tummy big. So there's a mass that is, making your tummy look big, creates a bulge in the lower tummy. It can press onto the bladder. If it presses onto the bladder, it can cause urine problems. It can press onto the ureter. So it causes flow from the kidney. It's blocked. Urine can accumulate. The kidneys can become dilated. And then it can end up causing problems in the kidney function is affected. So long-term basis, that is not a good thing for it to happen to you. It can press onto the rectum, which can cause you to have constipation because now the tube that the feces should pass through is now narrowed because of the mass of the fibroid, and feces get stuck above it, and that also comes with its own issues. So the mass, basically, it's causing trouble front, back, side, just by its presence. Then it can be in the middle of the muscle where it may not cause any problem for you to notice, but then you would have problems with if you get pregnant, for instance, blood supply to the fibroid is affected, and therefore it causes significant pain. Or then if it's where the baby is supposed to lie, that's the inner part of the uterus, it causes bleeding problems.
I see.
And it can cause significant bleeding problems. The periods can be long, periods can be heavy. You can basically bleed all your blood out if it's not controlled in time. And the periods, and then sometimes even after the period has ended, the surface is a bit raw, so it causes a discharge. So it can cause a continuous yellowish discharge that is not stopping because of the raw surface on top of the fibroid.
Okay, I get it. So if you're going through any of these, then it means that it's causing problems and it must be attended to.
But some fibroids do cause no problems at all. They are just lying there minding their business.
But it's still not their space, right?
No, they are not supposed to be there. But
now, the other question that I want to ask for this woman, because she mentioned that she doesn't have kids, just in case she is still thinking at 47 of having children, how possible is that?
It is possible to have a child at 47.
Because she has had 2 fibroids.
It depends on the location of the fibroid.
Okay.
If the fibroid is in the inner parts, what you call the submucous fibroid, the type that causes the bleeding, that fibroid, because of where it's located, causes like a family planning effect on the womb.
Oh.
So you have a room. It's supposed to be an empty room waiting for a tenant to come and occupy. And then a squatter comes and sits in the room. When a tenant comes, he can't occupy the room because somebody is already in the room. So when the baby comes, he meets the fibroid there. The fibroid says, I'm here, and I'm part of the wall. I'm not going anywhere. You can't cohabit with me. So a few people, I've got a client right now who has a big fibroid and a baby all inside that space there.
And they're all thriving.
Interesting times ahead.
Yeah.
But for quite a number of people, it causes the mass effect. And then it causes you to have, it makes fertility becomes an issue. But with that, the good thing about that kind of fibroid, with the inner part, is that there's a technique by which we go through the vagina, we go through the cervix, we enter the womb, and we remove that fibroid, and we come out that way without cutting you.
I see.
And you go home the same day.
And then you can have your baby.
And then you can have your babies.
Okay.
You should come and watch one day.
Yeah, it would be interesting.
Yeah, you should come and watch one day.
It would be interesting. Let's talk about that. I'd like to. I am almost 60 and still have hot flashes and sweat profusely. Is it still menopausal or could it be something else?
We don't know when her menopause started.
Okay.
That's the problem with this thing. If she's one of those who had a very late menopause, she could still be going through the
How long is it supposed to last?
It depends on the individual.
Before you become normal again.
Let's say maybe 2 to 3 years. Hey. But it depends on the individual.
Some of us are not there, but we are asking for ourselves.
Yeah, we have to. Well, one of these days we'll have the menopause talk.
Oh yeah, we should.
Yeah,
full talk on menopause. I mean, why should we delay? Let's see how today goes.
Today we've got plenty of questions.
Yes, not today. We'll plan for menopause.
I went to a funeral and met a gentleman who says, Padi, I said yes. Charlie, the menopause, if I talk about them, the things my wife they do. And I said, yeah, we need to talk about menopause one of these days.
I was telling you when my first daughter first had him, like the menarche. Then, so I had some education with her. She said, can I just get this thing done and over with? I said, like how? It should just end so that I'll be free. I said, madam, this is until you are about 50 years. She said, there goes my life. That's a very tender age. So yes, when you were young and it's this coming, it comes with all the agitation, and then when you're approaching 30, we should have the menopause conversation in full. Adam, I am 51. I've had 3 children through CS. For the past 2 to 3 years, I have been having excruciating waist pains. Is it because of the CS, and what do I do for the pains?
I don't know what time her last child, how old her last child was, to see if there's any near relationship with it, but most of the time I would say no.
Okay.
When people have had surgeries, family planning, those kinds of things, they always attribute anything that happens to them, even if they have a car accident, they say it's because of the family planning or the surgery that they've done. I'll just give you an example. She may be somebody who does a job that requires heavy lifting, and she's been lifting things in the wrong manner. She may be sitting down very poorly on a regular basis in the office that she works in, or her office is not kind enough to get them good ergonomic chairs for them to sit on and protect their back. The result is that you have the back problems because of a lifetime of poor sitting or poor lifting habits or poor mattresses that you've had all your life. Unfortunately, it's the CS that everybody attributes it to. I think she needs to see a clinician for them to assess her properly.
Exactly.
On the waist pain, its cause, and then based on that, for her a solution.
Is there any chance at all after she probably goes for review in the hospital and all that, it could be related to the CS somehow?
We do a cesarean section in front. So we cut your tummy. You're having a problem with your back, especially if this is somebody who has had general anesthesia for all her procedures. You can't even attribute it to the spine now. So I wouldn't go there.
Okay.
She needs to be assessed.
Is it possible that, Doc, you know that when you're pregnant, you have some waist pains, right? After delivery, I mean, could it be that pain can have a permanent effect on you?
If she has repeated heavy babies, okay? But when you're pregnant with a heavy baby, it pulls your spine forward. You understand?
When I was pregnant with that waist, I suffered.
It pulls your spine forward and really distorts your balance.
I know, right?
And your alignment. If afterwards you maybe have another baby that's also big like that, then we continue to persistently misalign your spine. So after you've delivered, that misalignment may not necessarily come back. It may actually remain that way, and that is why you go and see those nice people the chiropractor people who would realign your spine.
I actually think that this is a very important question I asked. You know why? So that after 2 or 3 births, especially so if they were heavy, and you had the pains and you thought about it and you went to see, how do you call them, a chiropractor or a physiotherapist, and they checked it for you, they probably could start your alignment early, other than leaving it for a very long time.
So if your back is
I should have
you,
known. I should have known. But I have asked for you, so take note of that. You have your babies, when you have waist pains and they are quite persistent, you should go and check. Just say maybe, when you fulfill your tummy is that way, you're always, oh God. My son turned 12 2 days ago. Nice. My last one.
Nice.
So you should know. I don't even remember how pregnancy feels like. And I don't want to go there again.
Done.
Done, and done that. I've had irregular menses since March. It delayed for a week, but came normal later. For the month of April, I had menstrual pains like I always do when menstruating, but only saw some brownish spotting or bleeding when I clean after urinating for a day or 2. Just yesterday, the same brownish bleeding which soiled my underwears. But this morning, nothing at all. I visited my gynae and he asked that I do an egg test and that I might not be producing eggs.
Yeah, she may not be producing eggs, but I think they are on the right path. Once they do the assessment, they'll figure out what the problems are. When it comes to menstrual issues, there could be so many reasons. So many reasons. One of the commonest issues we have are people who just have irregular menses. Some people don't have menses at all. They have for several months before it comes. Some people just have very, very small menstrual flow. Some people have no menses for a long time, then they have a very long menses for 1 month. All of these are issues that can be fixed. They are not normal. They are not normal. So if you have those kinds of things, we should be able to see your gynecologist to try, especially those that they tell you that you've got PCOS. It's a very common condition. Yeah, polycystic ovarian syndrome. It's a very common condition. It starts when you're very young, but it generally comes with menstrual issues.
Menstrual disorders.
And so if you do a scan and tell you you've got polycystic ovaries, thankfully now, unlike before, there are good treatments for them. PCOS now is significantly manageable. Old, young, whatever it is. And it also comes with, they come with pimples, oily face, hair on their chin, all those kinds of stuff. It can be managed. Okay. It can be managed. There's medication for it available today.
Thank God.
In the olden days, we needed to do surgeries and things. We don't need to do that anymore. We can actually provide medication over a period of time. You will notice an improvement, and then you get a whole lot better. And for those who are not ovulating because of PCOS, once you take the medication consistently, you will ovulate.
At this point, I just want to say that if you wake up every day and you're healthy, and you don't have some of these issues, you shouldn't take it for granted and think that it is something you're doing right. I think you should just be grateful to God, because people deal with so much. Last week on Strong and Sassy, Minimwa hosted this young woman, I think, who is dealing with endometriosis, and when she was telling her story, oh God,
there's medication for that too.
There is, yeah. Your heart will sink, the things she has had to deal with. Some for some people too, some of us too, right? Back in the day, when you miss your period for a day, you know you are pregnant because it is so regular. It's not funny. Yeah. You miss it a day, you know that that is it. So. Let's not take good health for granted. We should be grateful to God, and I hope that these conversations we're having, you're taking notes and asking further questions and seeing your doctor. Sometimes you read some of the questions and you're wondering, you want to ask, have you spoken to a doctor yet? Because it is seeming as though we have the challenges and we are, we're living with them and not asking questions around them until such a time. So please, if you find out that something is quite abnormal in your body, please ask questions. Or sometimes you can just do regular medical checks, Doc Anna.
Yes.
Yeah, regular checks. And then they always tell us that if it is picked up early, then it can be treated early. So regular checks to know what's happening with you is really very important. My next question here says that, Doc and Adam, I am 45 with 3 children. Practiced family planning for 5 years and stopped about 2 years ago. I have not menstruated since I stopped, but it came last 2 months for a day and stopped again. Please, am I experiencing premenopausal symptoms? And this is from Vivian.
It is possible, but it's also possible. She didn't mention the family planning.
The type.
But it's also possible that it could be related to the family planning method that she was on.
Doc, but these family planning, why are they so complicated?
They are not complicated.
I don't want to get pregnant, so I take something for it. I want to get pregnant. I stop taking the thing. My body should go back to normal now.
Yes, but it depends on the method. And that's the challenge, is that we should let you know, and that one, it's on S.
Okay.
We should let you know that this method I'm giving you, your body will come back to normal in 1 year. So when we are doing a method, we plan to stop it 1 year before you need it. You want to get pregnant. There's another one. We'll give it to you. We'll tell you this one, in 6 months' time, you'll be spotting small every day. It will happen. When it happens, come and see me. I will fix it. You understand? So the day you wake up and instead of your menses coming, it now comes every day, and then you're like, hey, it's not stopping, and it's coming small, and my husband is complaining. Remember that we told you when it happens, come back, we'll fix it. It will stop after a while, so we can sort it out. Once you know that these are the things to expect, then it's not a problem anymore. The challenge is that either we don't tell you, or when we tell you, you forget everything that we tell you, which happens. So a lot of times I'm like, husband, please listen to what I'm saying here, because your wife will ask you when you get home. That's what did he say? Even though she was here when I said it. And then they still come back and say, hey, the thing you said you did, I don't remember. But once they know that these things are to be expected, then when it happens, they just come back and we address it for you. But with the injectable, for instance, for example, it is known that it can stop your periods. And it is known that it will take a while for the periods to come back. 6 months, 9 months, maybe a year. No, it's not a problem. Once you know that that is how it works, somebody is working about this. She doesn't want the period to come. She is struggling with the period. It's causing her pain. It is this, that. When you give her the injection, the period stops, she's happy. You understand? So she will come religiously because, hey, I don't want the period to start again. But in case she decides to have a child, she must stop it early rather than wait till I want to have the child in March. So I stop the injection in February. January. Forget, it's not happening. You may not see your period that year. That's all. And by the way, you don't see the period because your body says, I know a pregnancy is not going to come, so I'm not going to lay the bed sheets down to have to remove it at the end of the month. You understand? It's not that there's something wrong with you. You are not sick. Your body just knows that since no pregnancy is coming, don't prepare for it.
But once,
that's all.
Anyway, I get what you're saying. But Daniela, please note, so we have 2 major topics we'll be dealing with. Menopause and family planning. We'll be dealing with these 2. And then we'll see how the calendar method has also worked for some people. And the other one that doc doesn't advise.
That one. It doesn't. It comes with problems.
Which are you know the one I'm talking about?
Yes, it comes with problems.
Oh, doc, are you sure?
Oh.
The withdrawal method.
Oh, withdrawal method. Yes, the withdrawal method comes with problems. However, the withdrawal method should only be used by the man who is more afraid of pregnancy than you are.
No worries, today we're not discussing family planning. If we'll come and talk about family planning.
If the man is not committed, Charlie.
Oh dear.
You forget.
These issues. This one says, okay, so another family planning one. I had family planning, the one inserted under the in 2019. It was for 2 years. It expired in December last year, but I have not had my menses normal again. About 2 months ago, it came continuously for 3 weeks. And that's it. Currently, it looks like it wants to come, but the flow is very small. What is the cause, please, and what do I need to do?
We know it's an implant. There are 2 types of implants. The 1 stick, what we have in this country, the 1 stick and the 2 sticks. The 1 stick is for 3 years and the 2 sticks is for 5 years. She didn't say which one she had, but I'm assuming if it expired in December, is it still in her arm? Because if it has expired and it's still in your arm, it's not supposed to be in your arm. Please have it removed, and if necessary, replaced if you don't intend to have any more children. The issue she's describing may or may not be related to the family planning method. If she still has it in her arm, then even though it has ended, there may still be some chemical inside that is still being excreted or secreted, and the result is that she may have the pain. The irregular menses may be related to the planning implant that is still inside there. But the best thing to do if the date is up is that it needs to be removed. She's been told that it will expire by December. Have it removed. And once you have it removed, the thing about the implant is that it releases a small amount of chemical every day. And that chemical does its work to prevent you from getting pregnant. We need to remove it. But once you remove it, the factory that produces the chemical is no longer in your body. So the chemical's effect is essentially gone. The nice thing about it is that you take it out this month, you can get pregnant next month. Because it's gone. It's left your system. Unlike the injection, when we give it to you, it stays there for quite a while.
We need to have a whole conversation on family planning. I remember some years ago when we had one such conversation. There was a research document. I've forgotten the country. And, you know, the men in that country were saying that they were having stomach problems and all because their wives were on family planning. I'll look for it and share it. It was so hilarious. Like they had severe headache. They had you remember that they had stomach problems because their wives were on family planning. But I think that look, with all these, we will have to have a whole conversation on it. I am not so abreast with family planning. Did you know that playing any musical instrument or singing activates the brain in ways no other human activity can? It's the total brain workout. So for the growing mind, music learning is an invaluable input to the brain's development. It is enjoyable, it instills discipline, and develops the mind. At Music Haven, we teach all the musical instruments, talk about the piano, the organ, the violin, the guitar, the saxophone, the trumpet. We teach both adults and children. So parents, why don't you enroll your children at Music Haven for a great musical experience? We're open Monday through Friday, 8 a.m. to 5 p.m. and on Saturdays from 10 a.m. to 3 p.m. You can find Music Haven on Mensa Saba Road near the Mala Mata Market and next door to Teledata. Numbers to call 0244356173 or 055-255-8398. We look forward to having your children in Music Haven. Make your children heroes among their peers. Music Haven, your musical coach. And for your eye care challenges, we're telling you to look no further. Amasha Partners Limited and Eye Care has it all. Your eyes deserve the best care and quality designer eyeglasses. Amasha Partners and Eye Care undertake the following services: supply of designer frames, sight testing, supply of lenses, sunglasses, contact lenses, ophthalmologist in attendance, and general treatment. Where can you find them? So you can locate them at La Opposite Trade Fair, Spinters, adjacent ICGC, before the Community 18 Junction, McCarthy Hill, they are opposite Benjay Lodge, North Kanishi Swan Lake, opposite Greenhand Junction, Achimota, second floor, inside the Dainswa Plaza, Takrade Axim Road, opposite CBG Bank, Ho, they are opposite the Housing Junction, Kumasi Airport Roundabout, Kolibu, opposite ECG and Koforidua Central Hospital Road, and Tema Community 1 in the Meridian Plaza. Numbers to call 0302939850 and 0302778827. Numbers again 0302939850 and 0302778827. You can follow them on Facebook, Twitter, and Instagram. And this weekend, it all comes down to the wire. It's the grandstand finish in the Premier League and Serie A. In the Serie A, another episode of the Milan rivalry is revived as AC Milan and Inter Milan battle for the Serie A. On the Sunday 22nd May. In the Premier League, will Steven Gerrard be kingmaker in who lifts the title? Well, all of this is happening and you'll have to get it on DSTV. We'll tell you a bit more about it later. And Mother's Day is over, but you still can show your mom love throughout the month. She deserves it. Watch out for Dove's in-store outlets near you and grab Dove's special Mother's Day bundled packs at affordable prices. Find out in-store outlets at the Palace hypermarkets in Tema and Spinters. Shop right at Accra Mall, Achimota Retail Center, Achimota Retail Center, Junction and West Hills Mall, Marina Mall, Batrona Total, Melcom Kanishi, Spinters, Tema, Nana Chrome, and Achimota branches. Game at Accra Mall and China Mall in Ashaiman. The next question here says, good morning, Adam. Before I turned 60 last year, once in a while, I spot blood. I went to the doctor and was told some stubborn eggs want to be fertilized, and because it's failed, that's the spotting of blood. How true is this? This is from Ifwa in Osu. But doc, we will take a very, very, very quick break. When we come back, we will answer this question that's asking of spotting. So stay tuned in. We will be right back.
Ophelia, did you brush your teeth before eating?
No, Mommy. Anytime I use Daddy's toothpaste, I get bruises in my mouth and sometimes I feel like vomiting.
That's not an excuse. As a child, you need to brush your teeth before you take your breakfast to avoid tartar and cavity, okay? And you, why are you laughing at your sister? Have you brushed your teeth?
Yes, Mom. I used the Kel Kids toothpaste you brought yesterday to brush my teeth.
Well done, darling. Kel Kids toothpaste is made for kids like you from 2 years to 6 years.
It was so sweet like strawberry. I even wanted to eat it, Mom.
No, you can't eat it. It's toothpaste, not toffee, okay? It's always advisable to give your kids Kel Kids toothpaste to brush their teeth. Kel Kids toothpaste strengthens teeth and prevents decay and cavities. As a mother, I always make sure my kids use Kel Kids toothpaste. Kel Kids toothpaste with strawberry flavor makes brushing exciting for our kids.
Kel, happy smile.
This advert is FDA approved.
Do not improvise an auto gas cylinder. Make sure the auto gas cylinder is properly installed by a qualified technician. Always keep a fire extinguisher handy in case of a fire. Stand at a safe distance and attack the base of the flames. Avoid decanting LPG from one cylinder to the other. Domestic transfer of LPG should be avoided. Cars fitted with auto gas cylinders should be filled at appropriate filling stations. A message from the National Petroleum Authority.
Remember your dreams that got chopped?
The dream queen size bed.
The dream sofa?
The dream cookware.
That's why Orca Deco has sliced, diced, and chopped prices in the Orca Deco Price Butcher promo so your dreams come true.
Shop at Ghana's biggest furniture store today to get up to 20% slash off the price of everything at Orca Deco. Woo! Day.
Keep your dreams at home alive and shop big discounts at our Accra and Kumasi stores today. Think home, think Orca.
There's going to come a time that the church will rise as the highest of all the mountains, and saviors will be raised in the church to deal with the world system. And let it be now. We need to have a national focus. We don't have to lose this ambition, or else we work against the Great Commission.
They are equipped in righteousness, the agenda to possess the nations. Welcome to an equipping center of the word and prayer on Pentecost Hour. Pentecost Hour comes to you on Joy 99.7 FM, this and every Monday at 9:30 p.m.
Thank you for staying tuned in. This is Home Affairs. We're live on Joy 99.7 FM, also on Joy Prime Television. If you're just joining us, you missed a bit, but there's still more you can learn. We're spending time with the Obs and Gynae, Dr. Padi Aryertey of Elimas Health. Specifically, we're asking questions related to Obs and Gynae. And so you can send your questions through. We still have some time, about, some 20 minutes to go. 055-1111-997. And we will be activating the phone lines in a bit. Actually, we can activate the phone lines now. So 0302-216541. You can actually call and also ask your questions. So we asked this one before we took the break. Before I turned 60 last year, once in a while, I spotted blood. I went to the doctor and was told some stubborn eggs want to be fertilized. And because it feels that's the spotting of blood. How true is this? This is from Ifua. She lives in Usu.
Well, no, it is not true. Secondly, any bleeding after
but
menopause.
how can the doctor give false information like that?
Charlie.
Hey.
Okay.
Wow.
Let me just address her issue.
Yes.
As for the doctor's issue, I don't know what to say. Any kind of bleeding after menopause is worrisome. And that is because
you mentioned the
bleeding can be from the cervix as a cervical cancer or from the uterus as an endometrial cancer. Both of which can kill you.
Wow.
But both of which, if caught early, will save your life.
Right.
So we don't joke with any kind of bleeding.
After menopause.
That doesn't mean that's the only cause of bleeding. It could be a cervicitis, it could be a vaginitis, it could be, there are other kinds of things. Even ordinary small inflammation can cause bleeding over there. So that is not to say that any bleeding is cancerous. But any bleeding is potentially a cancer, and therefore cancer must be ruled out.
Okay.
So once you've hit menopause, periods have stopped. In this woman's case, she's 60. That means they've stopped for quite a while.
Oh, quite a bit.
And then you see any kind of bleeding, you need to be properly and fully assessed.
And not to be told that you have stubborn eggs that want to be fertilized.
No.
I see.
Properly and fully assessed. Because if it's cancerous and you don't do anything about it, it spreads, and then eventually you are told that nothing can be done. And you die from a condition that could have been prevented.
Oh dear.
It's unacceptable.
Yeah. So please, you need to let the doctors have a second look at it. Doc, I know we said we're going to deal with menopause as a subject on its own, but I want to find out from you. So how long does it take for it to grind to a halt fully, that you know that, okay, now next month they won't come?
The periods?
Yes.
No.
Is it just once and it goes off?
No. It's a gradual process.
Exactly.
And usually you would notice the menstrual changes. And then after a while, the menses stops. And then after a while, you notice you may not notice the hot flashes initially. You understand? Then at some point in time, you start noticing that,
I mean that averagely, how many
it
months
depends
does it
on
take?
the individual. Everybody is different.
So some people, it takes
some
how long?
people. I won't tell you. You use it as marking scheme.
I don't use it as marking. I just want to have an idea.
When your own pass is not like, hey, I'm in trouble.
No.
I won't tell you. Just know that somebody's zone takes long. Somebody's zone takes a shorter duration. And we all differ in that respect.
Okay, don't worry. When we are doing menopause, you will not say you will not answer that
question.
You
me down on that one.
Because I have a lot of questions on my mind. I mean, the question I'm asking you reminds me when I was trying to tell my kids about when they kept asking how a baby is born, then I remember saying, sometimes, they were young then, you have to cut the woman's stomach
and take the baby
out. So for a child, when you say that, I'm expecting, hey, mommy, but there will be blood. No. The next question simply was, and at other times, they were expecting something else I didn't say. So you're not telling me what I want to hear. Good morning. Please, I want to ask if there are chances of getting pregnant when I have sex few days after my ovulation and taking medications not recommended for pregnant women, and if there should be pregnancy, will the baby come out normal? This is from Regina.
Okay, so sperm can live for up to 5 days in the female reproductive tract. So technically, it means you can get pregnant even if you had sex 5 days before ovulation. So that is one. Now, assuming you take medication that are not particularly good for pregnant women, the time you took the medication, you weren't pregnant from her description, because it was during a period before her ovulation period.
Yeah.
And most medications will leave your system before, but you fertilize, then you implant. All that takes, at least a week after ovulation. And then the main issue when it comes to medication is within the first 70 days. And that is where if you take the wrong medication, you may have a significant effect on the baby. However, most of the medications you are told not to take it, not necessarily because it will cause a problem. It is that because we have not been able to rule out the potential of causing problems. And so we tell you it is not recommended that you take it. But unless there are some medications that they'll tell you straight, if you are taking this medication, do not get pregnant. Because we know it will cause trouble. If it's not one of those things, most likely you'll be fine.
So what should she do now that she's worried?
But she's not yet pregnant.
She's saying...
She's not pregnant.
She could be.
When she gets pregnant, she just has to inform the doctor that I took this medication at this time. He would look at a specific medication, and give her advice based on the specific
What should be
medication that she took.
Okay, great. Hi, Amanda. Good morning.
Good morning, Eden.
How are you?
I'm fine. What about you?
I am well, thank you. Amanda, you seem quite far away from your phone.
I'm actually using my head.
Okay. Let's hear you, please.
Okay. Please, I'm 26 years old. My son is 3 years. After delivery, I had to I discovered I had a ball in my stomach.
Amanda, please hold on. Hold on. Let me call for assistance in our studio. We can hardly hear you. And so, Daniela, please, let's have it checked. Let me read this message while we check Amanda's. Hello, Adam. Please ask. My wife has had about 4 miscarriages. Hello, Amanda.
Hello, Adam.
Yes, it's better now. But kindly move away from your radio set. We're getting feedback. That radio or television, we're getting feedback.
Hello?
Yes, great. Let's hear you.
Okay. I'm 26 years. I had 2 eggs to deliver. And after the 2 years, I discovered I had a bulge in my stomach. So I went to see the doctor and he said it's umbilical vaginosis. I just want to know how alarming that.
What you say you want to know?
How alarming umbilical vaginosis.
An umbilical hernia is not very alarming. A hernia is usually a defect in the abdominal wall. In this particular case, it could be in other places. And part of your abdominal contents is protruding through a small defect in the wall. Pregnancy tends to stretch the abdomen. So if there's a small hole can become a bigger hole, and therefore things can protrude through it. It is, unless something gets stuck inside, its main problem is that it doesn't look nice. It can be repaired. It can be surgically repaired. The hole can be closed, and the problem would go away.
Okay, great.
So no, it's not too much of a problem.
Nice. Adam, I'd like the doctor to tell me the difference between IUI and IVF. I've been trying to get pregnant for the past 3 years. Upon investigations, my husband was told he has low sperm count and that the sperms are not shooting in the right direction. The only options we were given were surgery on my husband to correct the malfunction or IVF. Kindly let me know what you think.
That's like 3 or 4 different questions. IUI is when we take sperm, wash it, clean it, let them run through an obstacle course, choose the best, and then suspend it in a new fluid and put it inside a woman who is just about to ovulate. IVF is that we still go and take the sperm like that, but in addition, we give the woman injections, we take her to theater, we use a needle to draw the eggs out of her body, we combine the egg and the sperm together in the lab, put it in an incubator. When an embryo is formed, we transfer that embryo back into the woman. So IUI is a lot less invasive, a lot cheaper, and IVF is more invasive, but more successful.
Okay.
The combination of, if you compare the two. The husband's issue, there are 2 different things they've said. One, the sperm count is low, and usually that doesn't require surgery. And the other one is a sperm shoot in the wrong direction. I'm wondering whether she's talking about a retrograde ejaculation, which means you ejaculate, instead of ejaculating out, you ejaculate into the bladder. That exists. But there are medical conditions that if you treat, the retrograde ejaculation goes away, and they now ejaculate forwards. So it might not necessarily require a surgery in all kinds of cases. I've got a client like that once we manage his medical condition, the sperm comes forward. Once he goes off his medication, he goes backwards. The backwards one is more difficult. Then you're required to urinate, then we take the sperm out of it and wash it and clean it and use it. Complex issues. But either way, they can be addressed. So, but if the sperm count is low, sometimes an IVF is just the most straightforward thing just to do about it.
All right, great. I hope you got some advice there. Hi, Martin Luther. Good morning.
Good morning.
How are you? It's been a while.
Yes, it's been a long time, but I've been listening to the program.
Say again.
How are you? And first of all, good morning and good morning to your cherished customers. As I said, Martin Luther from Lamponi. Naturally.
Oh dear. Oh, Martin Luther, please call us back. Good morning. You never read my messages. Oh dear, but it's okay. It's not deliberate. I'm sorry. Please, Doc, what is PID? And how does one get infected? Can it just occur on its own? And this is from okay, I'm unable to pronounce it. Nitia from Adabraka.
And PID is pelvic inflammatory disease. It occurs as a result of an ascending infection, usually infection that ascends from the vagina into the cervix, into the womb, and then into the tubes, and then into the pelvis. And infection is caused by organisms. And those organisms, once they get into those areas, they grow. They cause a discharge. They cause damage to the tubes. They cause scarring. They can cause an abscess in that area, and it comes with pain. It can be treated with antibiotics. It's important that we treat it aggressively and early because of the damage to the tubes. And there are a lot of women who have had PID, taking some small antibiotics, and it's gone away. The pain has gone away, but the damage has continued, and the tubes have been damaged for life. And then they go later on, they're trying to have a child, they can have a child, and we go and do an X-ray, and they tell you you've got blocked tubes.
Oh dear.
The blocked tubes may have resulted from that infection that you got,
which was not properly treated.
So a PID is a big deal. I used to have a boss who would insist that you must have antibiotics for 1 week. IV. In the hospital.
Okay.
Yeah, because of the damage to the tubes.
And listening to what you're saying, for the very best intentions. Your boss, yeah.
Yeah, he insists on it because the damage is, and that is part of the reason why we are like condoms are important. Because as a sperm, the semen will be coming with an infection. Assuming the semen is not coming with an infection, the infection that is already in your vagina can jump onto the sperm, and the sperm will carry it into the
inside.
Tubes. You see, so
Okay, Eric. Hello, good morning to you. Hello, Eric. Good morning.
Hello. Good morning.
Good morning.
Good morning, Doc. Good. So, thanks, Doc, so much. My wife and I have an issue, and I want to find out from Doc how he can be of help.
Eric, please go ahead.
Okay. So she has this an infection, sort of. Let me call it like that. I mean, from a layman's point of view. And when I go there, you know what I mean by that. I also get some dryness on my stick, and then sometimes it kills. And we've been to hospitals several times. They've done a couple of tests, and they couldn't really lay hands on anything specifically. Her place gets sore, and it makes it quite itchy for her as well. She has diabetes, I must say. So now they are suspecting that it's being caused by the diabetes, and she has to manage that. But I just want to take doctor's idea on it. If need be, we may just visit him in the hospital.
Something comes to mind immediately as to what the problem should be. And if that's the case, it should be pretty straightforward. I would, of course, need some additional information, but there's a particular, I think there's something we should be able to do about this condition.
Okay.
And the fact that she has diabetes even makes it more...
you are
more convinced that it is inclined to be in that direction. And if that's the case, you should get a treatment. 1 week's treatment should make a difference. However, if she's diabetic, she would have recurrences if we don't control the sugar. So maybe we should have a chat.
Eric, please leave your number with Daniela.
Okay. All right, then. Thanks.
Otherwise, we'll announce. Yeah, leave your number with Daniela. We'll connect you to
all right.
her.
Thank you.
I am 45. I had my myectomy in October. I am completely fine now. My concern is my tummy is still big, hard, and sometimes feel bloated. I couldn't exercise immediately after surgery since I was still in pain. I have since resumed my exercises of walking. I was also informed the fibroids could grow again, but what could cause it?
So first of all, your tummy is still big. I mean, I don't know who told you that if you remove the fibroid, the bigness of your tummy would come down. Because if the fibroid was not the reason why your tummy is big, after you remove the fibroid, your tummy will still be big. It's like those who say they can't have children after a fibroid surgery, and you ask them, did you have children before the fibroid surgery? And they'll say no. They say, why do you think the fibroid is the surgery is the problem? The tummy being big is something else that necessarily is related to the fibroid. The fact that the fibroid is gone and the tummy is still big means the fibroid is not the cause for the tummy being big. Please do your exercises. Your tummy is going to get smaller over time. You do know that abs are made in the kitchen and not in the theater. So if you reduce your calorie consumption and you continue your walking and your exercise, the result is that you will lose weight everywhere, including and maybe especially your tummy. You must also remember that the midsection fat is not only what you see outside. There's fat around the intestines, the visceral fat. That is the one that pushes everything out.
Oh.
So the weight loss starts from inside before you even see the manifestation outside. So.
But how about the bloatness? She says she's
the bloating. Yeah, the bloating. Once again, we need a bit more information. It may not be related to the surgery per se, but you know, for most people, bloating is diet related. Okay. I gave somebody some medication, and the woman told me that she's having bloated tummy and that kind of stuff. But does it contain milk? So I went to check and said, yeah, it contains a bit of lactose. Said, oh, I'm sorry, I'm lactose intolerant. I didn't tell you. So even supplements that we give to people sometimes can cause trouble. It can cause this bloated tummy and all kinds of stuff.
I have someone on the line. I just read this question and come to you. Doc won't answer that question. Doc, the question you didn't want to answer, somebody has it. She's 51. She still has her menses, although not regular. She's asking, when will it stop? She also says she has fibroid. Hello, good morning.
Yeah, good morning.
How are you doing?
I'm doing great.
Great. Please, let's hear you.
Doc, my wife have been listening to Dr. Circle for some time, I think about 6 months. And then she feels a little weak after, like, when nothing starts. We went to the hospital and then the doctor was saying she's having some, and it's kind of scientific way, so I think that will have to. There's multiple peripherally arranged small follicles.
Yes. I understand what that is. Go ahead.
In both ovaries. And when she goes, or when I want to go there, I have this funny smell that comes along with it. She dries very easily. And her tummy has become big after. I don't know what I should do or what.
No, you've got what you've described are at least two separate problems. The smell issue is a different issue. The peripherally arranged follicles around is one of the diagnostic criteria we use for conditions that have got people who have got PCOS. And if she's got irregular menses, peripherally arranged follicles, and one other thing, most likely she does have polycystic ovaries. She needs to be seen preferably by somebody who specializes in that area and needs to be addressed. PCOS is easy to treat if you know what you are doing. The smell issue too is we just give it the right treatment, it should be able to go away. Not a difficult problem to address. You need to see somebody who is conversant with it, and it should be solved pretty quickly for you.
Okay. I think I will probably come to the hospital again.
All right.
Okay.
Doc, the question.
Which one?
This one.
That one.
She's 51.
She's still 51. She's still having her menses.
Yes.
When will it stop?
When will it grind to a halt?
But I don't know when it started. It may take a year. Let's assume that it has. But she says she's still having her menses. Oh, now it's irregular.
Yes.
Oh, it may end within a year. Hopefully within a year.
Oh, you gave an answer.
Hopefully within a year.
You gave an answer eventually.
It will stop. The fact that she has a fibroid complicates things a little bit, but I think it should stop hopefully within a year.
Great. So we have an answer of some sort to that. Now, this weekend, the battle lines are drawn in the Serie A as the league comes to a close. Another episode of the Milan rivalry will be revived when AC Milan and Inter Milan go head-to-head for the title on Sunday, 22nd May. Can AC Milan finally win the Scudetto after an 11-year drought, or will Inter Milan successfully defend their title? subscribe to Go TV Max for 85 Ghana cedis and catch all the nail-biting moments. Go TV, love it. Hello, Adam. Please, my wife has had about 4 miscarriages after almost every 6 to 7 weeks in her pregnancy. Kindly ask Dr. Padi if we can do something about it. Doc, but sure, I have someone on the line and then we'll take this one as our last. Hello, good morning.
Hello, good morning.
Yeah, good morning. How are you?
Yes, very well, yes, sir.
Great. Please go ahead.
Please, I would like to know about this degenerative fibroid and why it's so painful. I mean, what is it physiology or whatever behind it? And how does it come? People that it affects, I don't know.
All right.
Thank you.
Thank you.
So degenerative fibroid is essentially a fibroid that is undergoing certain changes because it's not getting adequate blood supply. Let's put it that way.
But why should it?
Well, it's good for you because the fibroid that doesn't get blood will die. But that rotting process, for lack of a better word, the rotting process, comes with
pain,
producing of certain kinds of chemicals. And those chemicals cause the pain.
Oh.
So that's what happens. When the fibroid outgrows its blood supply, or due to pregnancy, the blood supply is diverted to other areas, then those processes occur. The chemicals are released. Those chemicals cause the pain, and it's really painful. But if you give you treatment, usually within a week, it gets better.
It should be better.
Yeah.
Okay. And before we take the last question, Kofi Owusu-Pipra Ministries presents Kofi Owusu-Pipra Live in Concert, a night of great music, worship, and launch of the Father's Gift album. Guests include Niela Ife Grace, Luigi McLean, and the legendary Mrs. Amy Newman. Date is 22nd May, that's tomorrow, 4 p.m. at the National Theatre. Tickets are going for 60 standard and 150 for an unforgettable VIP experience. For tickets, you can dial *725# 7000#, *725* 7000#, or contact Ticket Hotline on 0271 425445. Sponsors: Woody and DSTV Ghana, iPay Ghana, Joy FM, Lucozade Fan Milk, Meridian Natural Mineral Water, Always Sanitary Pad, Somo Vision, Verna Natural Mineral Water, Total Family Health Organization, Ines Fly, and Series. Get your Woodian fabric from their shop in Accra and win a ticket to the concert. Song Big God, media partners Joy FM, Graphic Showbiz Ghana. Every time is worship time. And our final question. Hello, Adam. My wife has had 4 miscarriages after almost every 6 to 7 weeks in her pregnancy. Kindly ask doctor if we can do something about it.
Yes.
Okay.
Something can be done about it. Recently, I had a client who had the same story, and she missed a period, and we're like, oh, let's put this intervention in place because of her history. And she was doubting it at first. I'm like, no, we are better err on the side of caution. Let's put the intervention in place. Pregnancy has stayed. She's crossed the 7 to 8 weeks border now. She's quite excited. At her last visit, I told her I'll see her in 1 month. She said, no, she's coming back in 1 week. So she wants to check on her baby every week. It is possible. There are 2 main problems that can occur. One of them is very difficult to fix, but for the majority of people, it is the other one, which if you give it the right medication at the right time, problem will be solved. Not a big deal.
Great, thank you very much. Dr. Osapo sent in a very naughty message. I will read it, Doc. But he says good morning to my boss, Dr. Aryertey. And then he says that using condom is good, but eating toffee with a wrapper on is hard. Hey, Doc.
It is hard, Mom, but at 70.
My doctors in there will end on that note. But thank you all for doing the listening. Doc, thank you very much for coming again. We still have 2 topics to treat, so we'll see how we'll structure them. But enjoy the weekend. My name is Aryertey, and to the team who works in the background, Daniela, Dennis, everybody, thank you very much. We'll do this again. Yes, we'll do this again next week. Weekends the show comes up, and then we will have News File, we will have Sports Link, we will have Showbiz A to Z, News Flash, and then Open House Party. So you want to stay with us on Joy99.7 FM. Enjoy the weekend. Bye.
Kofi Osopepra Ministries presents Kofi Osopepra live in concert, a night of great music, worship, and launch of the Father's Gift album. Guests include Neela, Ife Grace, Luigi McLean, and the legendary Mrs. Amy Newman. Date Sunday 22nd May, 4 p.m. at the National Theatre. Standard tickets 60 Ghana cedis and 150 Ghana cedis. For VIP. For tickets, dial *725*7000#. Also contact our ticket hotline 0271-425-445. Sponsors: Woodin Total Family Health Organization, DSTV Ghana, I Pay Ghana, Joy FM, Lucozade, Fan Milk, Ocean Spray and Vitrac, Meridian Natural Mineral Water, Always Sanitary Pad, Sumo Vision, Vena Natural